The Work and Pensions Secretary has sparked fierce debate after saying that Britain's approach to mental health is in danger of having gone too far and that the normal anxieties of life are being labelled as a mental illness. Mel Stride suggested an increased public focus on opening up about mental struggles had led to people self-diagnosing themselves and signing off work too easily. He made the comments amid the ballooning welfare bill, which is set to hit £100 billion this year, mostly fuelled by young people on long-term sickness with mental health conditions. Well, Labour MP Alison McGovern reacted to his comments this morning.
What needs to be addressed is to make sure that we have good work in this country that supports people's good mental health. So we need Labour's plan to support our health service, including mental health support with 8,500 extra mental health workers, so that we can improve that quality of service for people. That's Labour's plan.
Well, look, NHS figures show that 8.6 million people received prescriptions for antidepressants in the year just gone. That's a rise of 200,000 patients in just 1 year. It's a lot, isn't it? Meanwhile, more than 500,000 young people aged between 16 and 34 are off work due to long-term illness. That is an increase of 44% in just 4 years. So what do you think? Everyone's got a view on this. Are young people too weak to deal with real life? Let me know your thoughts. Email me gbviews@gbnews.com. Tweet me at gbnews. While you're there, go and vote in our poll. The results to follow shortly. But doing battle on this now is TV therapist Sally Baker and founder of Pimlico Plumbers. It's Charlie Mullins. Both of you, thank you very much. Great to have you both on the show. Charlie, I'll start with you. Are young people too weak to deal with real life, do you think?
Yeah, well, it's obviously there is an issue here because the minister has noticed the issue and he wants to get 150 back into the workplace. And I think we're at a stage where, you know, somebody goes to the doctor and convinces the doctor that they have a mental health issue, where years ago that you wouldn't dare sort of even think of that. The doctor would tell you what the problem is. And I just think they see it as a weakness now instead of the bad back problem, if I'm being honest. And, you know, it's just easy. I mean, a lot of them are getting signed off long-term sickness now. So they're blaming the COVID. They're blaming, you know, not coming out of their house. I'm not saying there's not issues there, but it's so easy to walk into the doctors and tell them you have a mental health problem.
Sally, is that true, TV therapist Sally Baker? I mean, it does seem as though there's an astonishing number of young people who are off with a mental health problem. You know, we didn't have that in the Blitz generation, did we? Go on.
Well, we might have had it in the Blitz generation, but certainly no one spoke about it. And the whole idea that just because we have more discussion about mental health means that everyone's in a better position is wrong, because there's no services. So, you know, one's mental health is dependent on environment, circumstances, and a broader picture. So if this generation is struggling with their mental health, here we are. It's more fallout from COVID. It's more fallout from the social contract of people believing if they work hard, they'll get on, has been broken. Young people are coming out of university now with immense debts. Doctors, junior doctors coming out with huge debts, starting on £14,000 a year. The social contract is broken. Instead of being aspirational, our young people are incredibly depressed and anxious. And they also see their parents anxious and depressed.
OK, look, Charlie, you've employed people of numerous different generations. How have the youngest generation compared to, well, some people maybe of, with absolute respect, your generation? Yeah,
well, look, I never used to get anybody, you know, over about 25 come in, say they've got mental health problems. And it was only a very few anyhow. I mean, it's escalated in the last couple of years. And I say, I'm going to disagree with Sally. Of course, there's issues out there, but they know it's a way of getting signed off long-term sickness. And, you know, it's obviously if the minister's attacking it. No, but you're saying no, Sally, but the minister says there's an issue with mental health. Sorry?
All right.
How great is it being on the dole on £70, £80 a week, or even less if you're still living at home in your...
Sally, look, you're talking rubbish.
Let Charlie finish and then I'll come back to you, Sally. All right.
70, 80 quid a week, you're talking nonsense there, because you've got other benefits that people are getting. You've got their parents are giving them money. So just to, no, look, it's not about the money. It's about they do not want to go and work, many of them. And we have to face the fact that we now have a generation of lazy people. And a lot of that is due to the COVID, stroke, seeing their parents at home all day. I mean, why does anybody never say we do have a lot of lazy people out there? And that's what we've got.
All right, Sally, I mean, is there not some truth to that? A lot of younger people are just throwing their hands up. They don't want to deal with some of the issues being confronted by them, and they've just thought, yeah, I will take the easy option out. I'll sit on my backside.
Generation after generation, all the way through time immemorial, young people have started their lives through the avenue of work. And it's given them possibilities. Now young people realise they can never get their own house. They can never, not even rent a room in a shared house.
But you can, though, Sally.
Yeah, but years ago, Sally, you couldn't buy your own house.
Sorry.
So why would you say about houses? You couldn't buy your own house years ago, so that's nonsense. It's just everyday life is out there.
People did manage it. It's impossible now. It's impossible now.
Yeah,
for
but
young
what has
people.
that got to do with going to work then?
The social contract whereby if you go to work and you work really hard, you will achieve things. You'll achieve independence, and you'll make your own way. Isn't happening anymore.
But what about personal... Sally, I'll stick with you. Just one sec, Charlie. One sec, Charlie. I just want to ask that. What about personal pride, though? Because it might be out of reach for a lot. It might be out of reach for a lot of people to get a house. I'm not disputing that in a lot of places, and I get that we've built a society around the idea that home ownership is a good thing, right? I'm not disputing that. But sitting on your backside every day and giving up is not going to do anything for your mental health, is it, Sally?
No, it's not, and that's what the majority of people don't do. People do try. They do, but the odds are stacked against them. Coming out of university now with huge amounts of debt. Most of them was during COVID when they were at uni, didn't even have tutorials or lectures. You know, the whole deal is broken down, and we need to put services back in. It's not about discussing mental health. It's not about... it's about supporting
Sally, when they went to university, they knew what it was going to cost them. And you say they're in debt, but most of them don't pay it back anyhow. So, you know, they're in debt, but they're not going to pay it back.
Interest rates have gone up on debts. They start paying it back as soon as they earn over 25,000. You know, you can't live in major cities
because they don't want to pay it back. I mean, Sally, how many people do you employ?
That's not a life for anybody. That's not a life. Young people are aspirational and they want to make their mark in the world, and the odds are stacked against them.
Can I ask? Yeah, all right. Could I ask? Are young people aspirational, want to make their way in the world? 500,000 young people aged between 16 and 34 say that they're off work due to long-term illness. That's 44% up in just 4 years, Sally.
Society has failed them, Patrick. Society has failed them. This is the first generation of never seen their parents who won't secure financial wealth more than their parents. This is a generation that's been failed, and it's showing up. It's showing up in their mental health.
Go on, Charlie. Final word to you.
I disagree with you. There's been problems for years. People have gone through wars. People have gone through recessions. People have gone through having labour in the 70s where there was so much unemployment. Look, if they want to work, they need to get out and go to work. Obviously, there's people that... Hold on, Sally, hold on. Just take a breath. There's obviously people that genuinely got mental health issues, disabilities, and caring for people, and we should be giving them more. But the problem we've got lots of youngsters that are milking the system, and not, instead of putting in the pot, they're taking out. Why do you think the minister has brought it up? Do you think he's got it wrong?
All right. Look, I'm just going to give the final word to Sally on this. I'm going to say, look, I've done a lot, genuinely. It might not seem like it necessarily given the tone of this discussion this evening, but I've done a lot. The GBNews viewers and listeners raised a heck of a lot of money for Mind, the mental health charity. So I am aware that it exists, obviously, the mental health crisis, especially a lot of young men, especially taking their own lives, unfortunately, things like that. But do you think it's too easy now, Sally, for people to play the mental health card at times?
No, I don't believe it's too easy to play the mental health card. And also, they all wait on average 2 to 2.5 years to see a mental health professional. I mean, they might get triage, but then they're on a really long list. And when they get to see someone, they'll have 6 to 8 sessions of CBT, and then they're thrown back off to the bottom of the list again. Okay. They need, real return to work focused support, and it can be done. This is a failure of society not to encompass and embrace our young and give them the best chances that they need.
All right. Both of you, thank you very much. It was a proper head-to-head. So good stuff. Thank you. Right, OK, so let's see what the comments are saying. Who do you agree with? Are young people too weak to deal with life? Christian says, very few people enjoy going to work, but some of us have pride. and do jobs we hate so we can pay our bills. Long COVID and mental health are being used by the terminally lazy. Paul on X says, no, most of them are fine, working hard in part-time jobs or minimum wage jobs that barely cover the bills. Peter says, time for a good old-fashioned kick up the backside. Well, there we go. Your verdict is in. 92% of you think that young people are too weak to deal with life. 8% of you disagree with that.